So welcome to my YouTube channel. You don't need to subscribe or smash the bell. Dr. Desiu asked me if I could say a few words about long-term care after a flap surgery, both in St. Vincent Hospital and at home. So I prepared a few notes, and I think it will basically help you better to understand what my comments. So I will begin by a few details about myself so you can better understand me. I became a paraplegic in 1969. Most of you were not born. You would be born decades later, following a car accident where I was a passenger. I then spent about 8 months in different hospitals in Quebec. In the 1980s, I was diagnosed with kidney stone and spent a few months in a hospital in Regina in Saskatchewan. Once again, then in the late 80s, still because of kidney stones, I was hospitalized for a few months in Germany. Most recently, in the fall of 2020, I was a patient at Montfort Hospital for 5 months and at St. Vincent for 3 months to treat pressure wound. It was at St. Vincent that I had the pleasure to meet Dr. Desiu. I have had a recurring pressure wound since 2012. It was initially superficial and eventually healed, but it will reoccur every summer and then heal again in the winter. But from 2018 onward, it did not heal. It became infected and I was hospitalized. It was at Montfort that I was told that a flap surgery might be appropriate for me. My only input in that decision was to consent to it. I did not understand what a flap surgery was at that time, and I still am not quite sure what it is. But I do know that there are many kinds of flap surgery, each one with different rate of success. After the surgery at Montfort, which was on my left leg and buttock, close to the anus, I had to remain about 3 months flat in bed. I was not even allowed to lift my head. I had a vacuum dressing, which took on average 90 minutes to apply to the wound 3 times a week by a team of nurses. I was transferred to the care of Dr. Desiu at St. Vincent, where I made slow progress. I was released 8 months ago in July 2021. At that time, I was told that the wound was healing, but very slowly. While at St. Vincent, I was prescribed an electric wheelchair, which I had to learn to drive. However, after I received my new chair, I became better informed, more savvy about what would be more appropriate in terms of equipment for me, such as a better cushion and more functions on the wheelchair, especially a vertical standing option, which allows an individual to stand up in his or her wheelchair. These functions release pressures on the muscles, provides better blood circulation, better bone calcification, and allows someone to stand up quasi-normally. I am presently in the process of procuring a better cushion. My chair does not have a vertical standing function yet, but I hope I will be able to find one soon which has such an option. I also had to install some expensive equipment in my home to relieve pressure on the wound, such as ceiling lift to make safe transfers from bed to chair or from the chair to the toilet and such thing. Furthermore, I had to change my hygiene routine to do it all in bed. Even if it seems intimidating, it's not much of a problem. Before the flap surgery, I had a fairly normal life as a paraplegic. I used a manual wheelchair, drove a car, worked for the federal government as a translator, traveled freely abroad, and had a normal home life. I particularly enjoy spending time in my cabin in Quebec, a 5-hour drive from where I live. I am married, and my wife and I have one daughter who is now an adult and a teacher. At present, I cannot use the cabin. I spend upwards of 22 hours a day lying in bed. I cannot do much at home either, but I hope soon things might eventually get better. During a follow-up visit with Dr. Desayou in November 2021, she informed me that my flap surgery was considered to have failed, as my wound was bigger than when I had left the hospital in July. She said it had become a chronic, non-healing maintenance wound. I said to myself that might very well be, but there is one thing that has not been tried: staying in bed all the time and not sitting at all. So that's what I decided to do, and to a certain extent, it seemed to have worked. The ulcer is now much smaller, perhaps 10% of what it was, but it is still not completely healed. A home care nurse comes every week to monitor my progress, and a wound care specialist, who I call a stomotherapist, comes once a month. They have taught my wife how to change the dressing, which she does daily. The whole process has progressively taught me to take ownership of my healing, because I receive a lot of information from different sources. At the beginning, I let the medical staff make all the decisions for me, but now I am more, so to speak, in the driver's seat, and I examine each suggestion that is made to me before a decision is made as to how to proceed. For example, in terms of equipment, I do not rely anymore exclusively on the advice of the occupational therapist, DOT, because I now know what is best for me. I need a custom-made cushion and a vertical standing option on the wheelchair. Sometimes a change of dressing might also be suggested, and I discuss all options with the wound care specialist nurse before proceeding. I firmly believe that the client should participate in the discussion with the medical team when important life-impacting decisions are being made. It is, of course, essential to remain in the care of a physiatrist so the long-term healing process can be monitored and maintained. For example, at my first visit with Dr. Desayou in November at St. Vincent, after I left St. Vincent, she taught us how to clean the wound and properly pack it firmly with silver cell. Most of the undermining consequently disappeared in a few weeks. Dr. Desayou has mentioned to my wife and me that the treatment of a pressure wound requires a team approach, where each one brings his or her expertise to produce, hopefully, an optimal result. And that concludes that chapter of my life.